Dear aspirants, welcome to my YouTube channel, Indian Anatomist. Today we are going to discuss the Ansa Cervicalis. What is Ansa Cervicalis? The Ansa Cervicalis is a nerve loop derived from the first three cervical nerves, C1 to C3, that provides innervation to the infrahyoid muscles, sometimes known as the strap muscles of the neck. Why is it called Ansa Cervicalis? Ansa means handle of a vase or cup. Cervicalis means neck region. How the Ansa Cervicalis is formed. Ansa Cervicalis has superior and inferior roots. The first cervical nerve forms the superior root, whereas the second and third cervical nerves form the inferior root. Dear students, most of the time, the superior root also receives fibers from the C2 spinal nerve. As they travel down into the neck, especially in a carotid triangle, both roots join together and form the nerve loop, Ansa Cervicalis. The superior root passes initially within the hypoglossal nerve for 3 to 4 centimeters, later it comes out of the hypoglossal nerve, and descends round the occipital artery first, then lies in the carotid sheath. By seeing the appearance, this root arises from the hypoglossal nerve, hence it is named, descendens hypoglossi. Although it comes from the hypoglossal nerve, it only carries C1, C2 fibres. Now coming to the inferior root. The inferior root of the Ansa Cervicalis is formed by the fusion of the second and third cervical nerves, hence it is named descendens cervicalis. Later, this root goes down below the internal jugular vein, and then goes in front of the common carotid artery. Finally, the inferior root from C2, C3, joins with the superior root from C1, and forms the Ansa Cervicalis, which is situated in front of the anterior wall of the carotid sheath in the carotid triangle. The formation of this nerve loop is completed. Now, what branches arise from this loop? The formation of this nerve loop is completed. Now, what branches arise from this loop? Dear students, please see this animation showing the formation of Ansa Cervicalis, followed by the branches, arising from the Ansa Cervicalis. Out of these two roots, only the superior root gives a branch to the superior belly of the omohyoid muscle. Whereas, the loop of Ansa Cervicalis gives three branches are, nerve to sternohyoid, nerve to sternothyroid, and nerve to the inferior belly of omohyoid. Dear students, please see that, the C1 spinal nerve also gives two more branches are, nerve to thyrohyoid, and the nerve to geniohyoid. These two branches do not belong to the branches of Ansa Cervicalis. Clinical anatomy of Ansa Cervicalis. Sometimes, C1 fibers run, and arise from the vagus nerve instead hypoglossal nerve, hence the superior root is named as descendens vagi. Occasionally double superior or inferior roots or double Ansa Cervicalis may be seen in the neck region. Professional voice users can get phonation disabilities after any injury. Patients with infrahyoid muscles palsy have no major vocal issues in normal speech, but lose pitch and prosody in singing. In unilateral vocal cord paralysis, anastomosis between the Ansa Cervicalis and the recurrent laryngeal nerve have enabled excellent to normal vocal cord function. During thyroid surgery, cutting the sternohyoid and sternothyroid muscles can damage nerve branches in the Ansa Cervicalis. Greetings, students. The lecture on the Ansa Cervicalis has concluded. If you have any inquiries about the Ansa Cervicalis, please leave them in the comment box. I anticipate our reunion in a forthcoming video. Keep yourself updated and remember to subscribe to my channel, Indian Anatomist. Greetings, everyone.